This morning, there are new safety concerns for women taking new formula birth control pills like Yaz.
A study released by the FDA finds newer versions of the pill seem to have a higher risk of dangerous blood clots. And Dr. Holly Phillips is here with more. Great to have you with us, Dr. Phillips.
Great to be here as always.
So what does the study show?
Well, this was a nice big study. It looked at 800,000 American women over the course of 7 years. Now, it found those taking one of the newer forms of birth control, called Yaz, had a 75% greater risk of suffering from a blood clot than those taking some of the older forms. Now, we know Yaz and some of the other newer drugs like Yasmin and Bayaz use a hormone in them called drospirenone that is known to increase potassium levels and may be the cause of these increased risk of blood clots.
All right, so for women that are on birth control pills, what are some of the symptoms of a blood clot?
The blood clot generally starts right below the knee in the calf. So those symptoms would be calf swelling and tenderness. That's just sudden, out of nowhere. You really aren't expecting for that to happen. Now, the clots become life-threatening when they move up to the lungs, and those symptoms you just can't miss. They are shortness of breath and palpitations. Getting into the emergency room right away can actually make the difference there between life and death.
So especially if you're on one of these pills, the first thing you should think of is going to the emergency room. Should women consider not taking these pills given all the side effects?
Right. Well, I would advise most of my patients not to make any rash decisions now. We're going to know much more in December. The FDA is going to compare this new study with some of the older studies out there and come up with some more definitive recommendations. But if you are on any birth control pill, whether it's the old form or the new form, don't smoke. That increases your risk of getting a blood clot far more than what form of birth control you're choosing. Also, try and maintain a healthy weight. That can cut down on your risk of clots. And if you're going to take a long trip on a plane or on a bus or on a train, get up and walk around. That helps to prevent the blood from pooling in your lower leg and cuts down on your risk of suffering from a serious blood clot.
It makes you wonder, given these serious side effects, why people are taking some of these newer pills. What do you say?
Right. Well, there are really a lot of advantages with these newer pills. Some of the most important, they tend to cause less weight gain, less nausea, and they can even battle acne. So it makes sense that women want to try some of the newer formulations. We just have to make sure they're not more dangerous than what we had before.
So basically, you really have to kind of get with your doctors and almost really tailor-make whatever birth control pill is right for you.
Exactly.
Because there are so many different side effects.
Exactly, Chris. Particularly if you have a high risk of blood clot, if you've had one before or you have that in your family, then maybe any birth control is not the right, birth control pill that is not the right choice for you. So you really have to tailor make it, sit down with your doctor and think about it.
All right.
Great information.
Dr. Holly Phillips, thank you.
Thank you.